there is compelling evidence suggesting that access to primary care helps people live longer and healthier lives. Primary care is prioritized to varying degrees and faces an array of different problems internationally. These challenges include, but are not limited to, lack of choice, variable quality, reactive versus proactive decisions, and physician shortages. One glaring challenge is the lack of unified, digital, and easily accessible system to store patient healthcare data, and it results for issues for patients, physicians, and governments. Patients do not have easy access to their medical information and history, physicians' decision-making and diagnostic abilities are impaired, and governments make decisions about public health based on non-accurate data. Walk with me so we can talk about this further. Primary care is often geographically and financially inaccessible. When patients do decide to see a GP, it often becomes a time-consuming venture that prevents them from seeing the general practitioner again. Instead, patients tend to skip GPs to go straight to specialist doctors, which is rarely a good idea. When patients don't get adequate primary care, it almost always leads to the use of unnecessary and expensive hospital resources. Overuse of hospital services, apart from the obvious problems like the increase in morbidity and mortality rates, completely depletes state resources that could be used to offer better quality care to people instead. Our solution is straightforward and powerful, making preventive, diagnostic, and telemedicine services cheap and readily available to the general public. It does not matter where you are, be it in the city, up in the mountains, or in a cruise ship. Our solution will be available always and everywhere. Let me show you what I mean. Meet Alex. He came in today to do a general checkup using our health check machine. If Alex is a first-time user, he can do the registration with his mobile phone or ID. Simple, right? Anytime he wants to register after that, all he needs is a face recognition or fingerprint. Alex can choose any language in which he wants the machine to communicate. Now, on to the exciting part. Health Check Machine will first measure Alex's height and weight, both of which are visible on the screen for monitoring. Then, the machine will go in depth by measuring his body mass index, body fat distribution, and body temperature.
Temperature measurement is completed.
After which, Alex can see his waist to hip ratio.
Start measuring blood pressure.
The device is equipped with technologies that can easily measure Alex's systolic pressure and diastolic pressure, as well as blood oxygen level, which are crucial indicators of general health. To top it off, Alex can now know his 2-hour post-meal glucose level, his uric acid, total cholesterol, and blood lipids in a matter of 3 minutes. Next, the machine will measure Alex's electrocardiogram, an important test that can be used to check your heart's rhythm and electrical activity. Based on the patient's symptoms and checkup results, the AI-based symptom checker will provide possible diagnosis by probability, conduct triage, and advice to contact a doctor. Data from this checkup will be sent to general practitioners to check in real time. Alex will be offered an online or face-to-face consultation with the general practitioner, and in case of necessity, will be referred to the appropriate specialist. Alex can view his checkup results on his phone. Communication continues within the platform. The patient's medical journey is monitored and analyzed in the system, and doctors can prescribe medication, do follow-ups, assign x-rays, or any additional checkups. All patient information will be stored in the cloud, readily available for retrieval anytime. The system is HIPAA compliant, which is so important. The benefits of the service are best shown if these digital machines are put regionally, all over the country, and controlled and monitored by telemedicine clinics. Digital primary healthcare is crucial, and the benefits are plenty.
Number 1, improved health system efficiency through decreased hospital admissions. Number 2, improved health outcomes, which leads to increased life expectancy and decreased all-cause mortality. Different studies brought significant evidence regarding improved health outcomes by increasing access to primary care. The third benefit of digitized primary care system is improved population health information and more reliable patient data. Isn't that great? And lastly, the system brings about serious economic benefits through increased workforce productivity. Digital primary healthcare is here to stay and help millions of people live healthier and happier lives. We hope you can join us in the journey of making digital primary healthcare widely accessible.